You never want a serious crisis to go to waste. And what I mean by that, it's an opportunity to do things that you think you could not do before.
You know, we have the chief of staff for President Obama is an old friend of mine and my husband's, and was in the White House when Bill was there, and he said, you know, never waste a good crisis.
This crisis also presents an opportunity. It's a catalyst.
Today, the Emergency Committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of Mpox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law. The Emergency Committee's advice to me and that of the African CDC Centers for Disease Control and Prevention, which yesterday declared a public health emergency of regional security, are aligned.
For member states, affected member states, at-risk member states. I also want to highlight that the Director General extended the standing recommendations for Mpox for another year. He mentioned that at the press conference last week, and those are online. We could put that link in the chat. With regards to transmission, there's multiple modes of transmission that we really need to better understand. Primarily what we are seeing is the contact type transmission. We have seen sexual transmission, which is really what is concerning us. And now we have seen this virus, the different clades, and in particular clade 1B in sexual networks. And this is where we need to have targeted interventions, stronger surveillance, stronger contact tracing, stronger risk communication, community engagement with affected communities, with CSOs, with people on the ground, so that we could limit that onward spread. We've said this before. You've heard DG say this. You've heard Mike say this many times. We can stop transmission of Mpox with a concerted effort using a multiple approaches in terms of looking at how the virus is transmitting in which populations. We do see transmission among families as well. We do see zoonotic transmission in addition to that. So these are the primary ways that we are seeing this virus spread. A lack of access, especially in low and middle income countries, and we're seeing that here as well. So part of the work that we are doing is not just trying to look at access to vaccines and therapeutics, but also access to diagnostics. So across the spectrum of having stronger surveillance, where we have surveillance, making sure that we have good contact tracing. So when we identify a case, we look at the exposures of others in the context so that we could prevent the onward spread, making sure that we have accurate, reliable, affordable diagnostics, and making sure that those are accessible in countries, working with manufacturers of diagnostics to make sure that those reach the countries in need. If there are requests for diagnostics from countries, that is something that we need to be aware of. We are aware of several, and we are looking at how we can get those those diagnostics into country. Get those those diagnostics into country. Get those those diagnostics into country.
It'll take probably about $1 billion a year for a pandemic task force at the WHO level, which is doing the surveillance and actually doing what I call germ games, where you practice. You say, okay, what if a bioterrorist brought smallpox to 10 airports? You know, how would the world respond to that?
Meanwhile, earlier, as you received notice from the Massachusetts Department of Public Health, there's a patient in the Commonwealth of Massachusetts who has been confirmed to have infection with monkeypox.
Get Bill Gates in here!
There are growing questions today around a new and deadly outbreak scientists determined that this monkeypox virus was engineered. With limited antiviral drugs and no known effective treatments, countries around the world are struggling to control another pandemic with already devastating effects.
Seeing far fewer cases in countries where governments took early and decisive action.
And some international experts are urging the WHO to adopt a phased approach to warnings.
I'd like to call to order this secret conclave of America's media empires. We're here to come up with the next phony baloney crisis to put Americans back where they belong, in dark rooms glued to their televisions, too terrified to skip the commercials.
Well, I think...
NBC, you are here to listen and not speak. I think we should go with a good old-fashioned public health scare.
A new disease. No one's immune. It's like the summer of the shark, except instead of a shark, it's an epidemic. And instead of summer, it's all the time.
That is so...
Now, I hate to be the guy who derails what everybody else loves.
He loves being that guy.
But, Janice, we do have standards. This can't be a made-up disease. The only moral thing to do is release a deadly virus into the general public.
We do have something we've been holding on to, but it hasn't been tested. Get over here, NBC.
Well, we certainly believe in testing, but Wow. Oh, yeah.
So, we've got our deadly disease. Now, we just have to blame it on something that's in every household, something that people are a little bit afraid of already. House cat flu is coming, people. The Center for Disease Disinformation predicts with some degree of probability that the house cat flu might spread in the following hypothetical outbreak pattern. So petter beware, that warm body on your lap just might be ready to destroy your tender fiddles. Springfielders are advised to stay tuned for more information if they experience any of the following symptoms: mild thirst, occasional hunger, tiredness at night.